name is Madison Thompson, and this is my audience.
Hi, I'm Tori Buckner, and this is Shivers.
I'm Kylie Newell.
I'm Dylan Keller.
Bailey Latham.
Catherine Freezy.
Lauren Elizabeth Lewis.
Has cancer ever personally affected your life? This year, there's an estimated 1,685,210 people that will have their lives drastically changed due to this disease. There are several people in my family that have been diagnosed with cancer, and a few people are still fighting this nasty disease today. Going through these things has helped me to realize how much the family is affected as well as the cancer patient. There are over 100 different kinds of known cancers. What cancer is, how it is diagnosed, and how it is treated can be very useful information if you come to experience with this dreadful disease. Firstly, what is cancer? The definition of cancer is a disease caused by an uncontrolled division of abnormal cells in part of the body. There are 4 stages. The first stage is less aggressive and it spreads less quickly. The 4th stage is more aggressive and it spreads more rapidly. The American Cancer Society claims the statistics of cancer. There's an estimated 1,685,210 cases that should be diagnosed this year, and an expected death rate of 595,690. That's approximately 4,620 cases and 1,630 deaths each day. The National Cancer Institute states the different causes of cancer: genetics and genes, sun and radiation exposure, carcinogens, alcohol, diet, tobacco, etc. Secondly, how is cancer diagnosed? The Cancer Cure Foundation lists different tests that can be performed to diagnose cancer. A cancer marker test is the first test and the earliest detection. A cancer marker test records the body levels, and if it comes back irregular, there are more tests to be followed. Other tests include blood tests, ultrasounds, PET scans, and full body CT scans, etc. If any of these tests come back irregular, they can perform a biopsy. A biopsy is taking a piece of tissue to see if there's any cancer cells in it. Third, how do you treat cancer? Cancer can be treated in a couple different ways. First, you go to an oncologist, a person that diagnoses cancer, a doctor that sees cancer patients. A oncologist discusses with the patient the different treatments, which is surgery, chemotherapy, and radiation. Surgery takes the cancer out of the body, some or all of the body part. Chemotherapy is the use of drugs to kill or slow the growth of cancer cells. Chemotherapy can be given an IV or by a pill. Radiation also slows or kills the growth of cancer cells. Radiation is very similar to an X-ray whenever it is performed. These can be performed in a combination or alone, determined by the stage or the aggressiveness of the cancer. In conclusion, informing yourself about what cancer is, how it is diagnosed, and how it is treated can be very important to know because it's such a common cause. Many families are affected by this disease daily. It's very hurtful to these families because they go through so much. They have to go through the patient treatment with them. They have to watch their family member either slowly heal or slowly decrease in their health. I had to watch my dad do that whenever I was in the 4th grade. It was very, very painful as a 4th grader when you were that young, and it's very scarring. My dad, my grandpa, and many of my aunts and uncles have been diagnosed with cancer. A couple of my aunts and uncles are still struggling with this disease today. They're still fighting it. A very close family member of mine are going through tests to potentially diagnose cancer. They just found out the other day, and they are also struggling very hard with this. Knowing about this disease can be very well, because hopefully one day we will find an actual cure for this cancer that is reliable. Thank you.